Jamaica, the land of reggae, sun-kissed beaches, and vibrant culture. But beyond the idyllic facade, a silent struggle persists, a struggle often hidden in the shadows. This exploration delves into the realities of mental health in Jamaica, peeling back layers of misconception to reveal the human stories at its core. The image of Jamaica often conjured up is that of a tropical paradise, a carefree escape from the stresses of everyday life. While the island's beauty is undeniable, this picture-perfect postcard often masks a more complex reality. We'll go beyond the tourist brochures and delve into the heart of Jamaican communities. By understanding their stories, we gain a deeper understanding of the systemic issues at play. We'll confront the uncomfortable truths about stigma and discrimination, exploring how they create barriers to seeking help and perpetuate a cycle of silence. Imagine a young man, bright and full of potential, struggling with crippling anxiety. He suffers in silence, fearing judgment from his family and community. Across Jamaica, countless individuals battle mental health challenges hidden behind a veil of silence, shame, and fear. The stigma surrounding mental health in Jamaica is palpable. This silence has far-reaching consequences, preventing individuals from seeking the help they need. The roots of stigma run deep, often intertwined with cultural beliefs passed down through generations. Traditional explanations for mental illness, such as spiritual afflictions or curses, can overshadow medical and psychological understandings. This generational inheritance of stigma creates a complex landscape for addressing mental health in Jamaica. Breaking down these deeply ingrained perceptions requires sensitivity, open dialogue, and a willingness to challenge long-held assumptions. The key lies in finding a balance, encouraging open conversations about mental health within these spaces. Jamaica, like many nations, carries a legacy of historical trauma. From colonialism to economic hardship, these experiences leave an indelible mark on the collective psyche. Addressing mental health in Jamaica requires acknowledging the role of these historical and ongoing traumas. Creating a more equitable and just society is essential for fostering mental wellness. It requires investing in social programs that address poverty and inequality, creating safe and supportive communities. Across the sun-drenched landscapes of Jamaica, a harsh reality casts a long shadow: poverty. The stress of living in poverty is relentless, triggering a cascade of mental health issues. Poverty often brings with it social isolation, discrimination, and a loss of dignity. The feeling of being marginalized can erode self-esteem and hope. In such an environment, mental health often becomes a luxury, something that takes a back seat to the more immediate concerns of survival. Education, often hailed as the great equalizer, has the power to transform lives and uplift communities. But in a country grappling with limited resources, access to quality education remains uneven. This lack of opportunity not only perpetuates the cycle of poverty, but also has a profound impact on mental health. For young people, education is about building confidence, developing social skills, and creating a sense of purpose. Investing in quality education for all not just an economic imperative, it's a mental health imperative. In a perfect world, access to quality health care would be a fundamental right, not a privilege. However, for many in Jamaica, navigating the healthcare system, particularly mental health care, is a daunting challenge. There's a critical shortage of trained mental health professionals, particularly in rural areas. The financial burden of treatment, often out of reach for low-income families, further exacerbates the issue. Addressing the mental health crisis in Jamaica requires a multi-pronged approach, including increased investment in mental health services. In Jamaica, where vibrant culture intertwines with a rich history steeped in folklore and spirituality, mental health often finds itself entangled in a web of misconceptions. Traditional beliefs sometimes cast mental illness as a consequence of supernatural forces. While these beliefs provide a framework for understanding the unknown, they can also perpetuate stigma. The belief in Obia, a folk magic tradition, is one such example. It's crucial to recognize that while these beliefs may offer comfort, they should not overshadow the importance of seeking professional help. The language used to describe mental illness often reflects the stigma surrounding it. In Jamaica, terms like mad or crazy are casually thrown around, trivializing the struggles of individuals facing mental health challenges. The MAD label carries with it a host of negative connotations, creating fear and distance. This misunderstanding stems from a lack of awareness about the spectrum of mental health conditions. Educating the public about the various forms of mental illness is crucial to dismantling harmful stereotypes. While the stigma surrounding mental health in Jamaica is undeniable, it's important to acknowledge the growing network of resources available to those in need. Navigating this landscape can be challenging, especially for individuals and families grappling with limited resources. At the forefront of mental health services in Jamaica is the Ministry of Health and Wellness. Beyond government-run facilities, a growing number of non-governmental organizations, NGOs, have emerged as crucial pillars of support. They offer a lifeline to many, providing a safe space for individuals to share their stories and access support groups. Among the many organizations dedicated to improving mental health in Jamaica, a few stand out as beacons of hope. The Jamaica Mental Health Advocacy Network, JAMHAN, has been at the forefront of advocacy efforts. Another vital organization is Choose Life International, CLI, which focuses on suicide prevention and intervention. Their work is particularly crucial in a country where cultural taboos often prevent open discussions about suicide. Several smaller community-based groups and initiatives are making a difference on the ground. Despite the growing network of resources, significant barriers to accessing mental health care persist in Jamaica. Geographical limitations pose a significant challenge, particularly for individuals residing in rural areas. Financial constraints present another formidable barrier. Addressing these barriers requires a multi-pronged approach. Promoting mental health literacy and reducing stigma through public awareness campaigns can empower individuals to seek help early. Leadership in its truest sense transcends the confines of political office or social standing. In the realm of mental health, leadership in Jamaica demands a bold vision and unwavering commitment. Political leaders bear a unique responsibility in shaping public perception and driving policy changes. By openly addressing mental health as a national priority, they can pave the way for a more compassionate society. True leadership demands concrete action, translating words into tangible support systems that reach those most in need. Section 2. Beyond words. Translating vision into tangible support. Leaders can effect change by investing in mental health infrastructure, establishing community-based clinics in rural areas, bridges the access gap. Increasing trained mental health professionals addresses the critical shortage. Supporting telemedicine connects remote individuals with providers. Integrating mental health education in schools equips young people. Promoting mental well-being in workplaces reduces stigma. Leaders foster collaboration between government, NGOs, and communities. Faith and fragility, a complex tapestry. Religion holds a thread of profound significance in Jamaican culture, offering solace and guidance. Faith serves as a source of strength, especially during adversity. However, the intersection of religion and mental health creates complex landscape. Faith can heal, but also perpetuate stigma, creating barriers to professional help. Seeking solace. Finding balance between faith and treatment. It's crucial to acknowledge that faith and professional mental health care are not mutually exclusive. In fact, many individuals find solace and support within their religious communities, drawing strength from prayer, rituals, and the sense of belonging that faith provides. Religious leaders, often revered figures within Jamaican society, can play a pivotal role in promoting mental health awareness and encouraging help-seeking behaviors. By fostering open and honest conversations about mental illness within faith-based settings, religious leaders can help dismantle stigma and create a more supportive environment for those struggling. They can emphasize that seeking professional help is not a sign of weakness or a lack of faith, but rather a courageous step towards wholeness. Integrating mental health education into religious sermons, workshops, and community outreach programs can further disseminate accurate information and empower individuals to make informed decisions about their well-being. Collaboration between mental health professionals and religious leaders is essential to bridge the gap between faith and treatment. By working together, they can create a more holistic approach to care, addressing both the spiritual and psychological needs of individuals. This partnership can involve referring individuals to appropriate mental health services, providing culturally sensitive counseling that respects religious beliefs, and advocating for policies that improve access to mental health care within faith communities. Redefining strength, embracing vulnerability, inspiring hope. Our journey through mental health in Jamaica reveals complexities and glimmers of hope. We've confronted stigma, trauma, and systemic barriers, but we've also witnessed resilience and community support. Breaking stigma requires embracing vulnerability and redefining strength. Seeking help is a testament to courage. and a journey toward healing. Thank you for watching.